coronavirus pandemic is fundamentally changing our societies. People are working from home, the streets are virtually empty, public spaces have been shut, experts advise against social interactions. The World Health Organization has laid a great emphasis on testing. They advise testing every suspected case. Enhanced testing has been the backbone of every successful coronavirus response. But do countries have the resources to carry out this kind of mass testing? Especially countries as big and populous as India, more than 1.3 billion people. How many will you test? India has set up more and more labs to test samples. More than 50 labs are functional, but 50 is a drop in the ocean for India. So what should the government do? Desperate times call for desperate measures. Look at what some of the worst affected countries are doing. Take the case of Spain. It's only a fraction of India's size and population, but the government of Spain has decided to take over private healthcare services. The entire Spanish healthcare system has been nationalized to deal with this crisis. All private health providers and their facilities are now under government control. The government can now even order a requisition of face masks and COVID-19 tests. Other countries are mulling different forms of nationalization. France, for instance, might take over big companies if needed. The president said that today. Germany is thinking about supporting pharmaceutical companies. In America, there's a call to take over critical private sector health companies. The mayor of New York, Bill de Blasio, has asked the American government to take control of key firms. He wants them working 24 hours a day to support the fight against the coronavirus. South Korea scaled up its testing by involving the private sector. The MERS outbreak in 2015 had killed 38 people in South Korea, and at that time, South Korea enacted a key reform. This allowed the government an almost instantaneous approval to gain access to testing systems. For the coronavirus outbreak, 90% of the testing has been done by the private sector in South Korea. And look at their success rate. India could adopt a similar strategy to ramp up its fight against the Wuhan virus. Services of the private sector could be requisitioned. Already accredited private labs have been allowed to test for COVID-19. There is a tight watch on supplies. Earlier this month, India had blocked the export of some essential drugs. This was a move to ensure adequate supply during the coronavirus outbreak. Countries around the world are making a case for nationalization. Don't be surprised if the government of India considers the same. Some form of nationalization, regulation of the health sector perhaps. It seems to be the only way to deal with shortages. Even ensure that every patient, rich or poor, gets the treatment they need. Allow the private sector to test. Ensure that the treatment is available to all and for free. India must dramatically scale up its efforts to contain the coronavirus, and it's time for the private players to do their bit. Learn from Air India, perhaps, the dying national carrier and its staff, evacuating Indians stranded in all parts of the world.